Good afternoon and good evening, everyone, and welcome to today's Global Alumni Spotlight Series featuring Dr. Karen Bureau. My name is Russ Gannum, and I am Associate Provost and Dean of International Programs at the University of Iowa. Before introducing Dr. Bureau, I'd like to tell you a little bit about International Programs Global Alumni Spotlight Series. The purpose of the series is to feature in-depth conversations with University of Iowa alumni who have extensive international backgrounds or experiences. It is designed to bring together current and prospective students, alumni, and the greater Hawkeye community for engaging conversations highlighting diverse expertise and experience. We strive to highlight success stories of Hawkeyes who have pursued excellent careers abroad or remarkable careers abroad, and Dr. Karen Bureau fits that description perfectly. Dr. Karen Bureau is a leader in global health and nursing. She serves as the second vice president of the International Council of Nurses. Her term runs through 2025, and she's been an ICN board member since 2017. ICN, or the International Council of Nurses, is the global voice of nursing with over 135 nurses associations in membership. Dr. Bureau has participated on the ICN delegation at the World Health Assembly and the WHO European Regional Committee, and has done so on numerous occasions. Dr. Bureau is currently chair of the ICN Membership Committee that is implementing strategies to strengthen national nurses associations with the ultimate goal of strengthening the global voice of nursing. As vice president of the Norwegian Nurses Association, or the NNO, from 2011 to 2019, she was strongly involved in organizing the collaboration between the NNO and nursing organizations in Rwanda, Malawi, and Zambia with the support of Norwegian aid. The purpose of this ongoing collaboration is to develop and strengthen the National Nurses Organization as a strong element of civil society. The UN Sustainable Development Goals are at the core of this collaboration. Dr. Karen Bureau has over 40 years of experience in nursing. She was engaged as Associate Professor of Nursing at the University of Oslo to introduce the first geriatric nurse practitioner program in 2011. She served as chief nurse of the Ullevål University Hospital in Oslo, Norway, from 1997 to 2001. And in terms of Iowa connections, Dr. Bureau received her PhD in adult and gerontological nursing from the University of Iowa in 2008. Her dissertation research investigated poor pain management as a risk factor for delirium in older people with hip fracture. She has a master's degree in nursing from the Institute of Nursing Science at the University of Oslo. She also has a certificate in intensive care nursing from the National Hospital of Norway. In addition, Dr. Bureau received a diploma in nursing from the Aker Nursing College in Oslo, Norway in 1982. We thank everyone in the audience for attending today's webinar, which will be recorded and posted on International Programs' YouTube channel. We note that we'll spend about 40 minutes on the interview itself and then open the conversations to questions and comments from the audience. Please submit your questions via the Q&A function. We are honored to have Dr. Bureau as our guest today. And Karen Bureau, welcome to the Global Alumni Spotlight Series.
Hello. It's
Hello.
nice to be here. Thank you so much for inviting me.
Of course, Karen. And so, how are you doing this afternoon, I guess, still in Norway?
Well, like I told you before we started, we're having our first blizzard of the year or of the season today. So I haven't been outside. I've been, watching the snow flurries fly by my window and looking forward to having this conversation as a brighter aspect of today's events.
Yes. And so, we experienced a little bit of winter this weekend. It got very cold. We actually had snow flurries yesterday. So not a blizzard like in Norway, but winter is certainly upon us. So you're right. Today's conversation will be a bit of sunshine that will warm us up, at least internally. And so again, Karen, thank you for joining us from Norway. And again, where do you live in Norway?
I live in Oslo. Yes.
In Oslo. Okay. Very
Very
good.
close to the Holmenkollen ski jump.
Excellent. Okay. Very cool. All right. So, Karen, the first question is always, what we ask to the interviewees or our guests. And so we'd like to know a little bit about where you grew up and how you developed your interest in nursing.
Yeah, that's really a good question. I grew up in North Minneapolis, and I took Norwegian language class in high school, and it was probably the only high school in the United States that offered Norwegian language classes. But in Minnesota, of course, that is possible. At least at that time it was. And then I went on to take a Bachelor of Arts degree in Scandinavian Studies at the University of Minnesota. And I had 2 study trips to Norway during my college experience. And I met my husband on one of those trips. So we got married in 1974, and I immigrated to Norway. And it was after moving to Norway that I changed careers from, becoming a teacher, which was my original plan, to nursing. And my mother's a nurse, and she cared for my father when he was at home dying of cancer way back in 1973, 50 years ago, really. Wow. And that experience had a tremendous impact on me. And I decided that nursing would be a meaningful career. And nursing is also an international career, an international profession that I could use if I were ever to go back to the United States again. So I applied for nursing school. That's a 3-year program in Norway, and I received a diploma in nursing. Then I went on to, like you said in the introduction, to do a program in intensive care, got a certificate there. And then again, back to school to do a master's in nursing administration. So all of my nursing career has been anchored in the Norwegian system.
Very good. And so I assume that you use Norwegian language all the time, that you are perfectly bilingual, and that your language skills, the ones that you acquired in high school in Minnesota, have served you well over the years.
Yes, definitely. I am bilingual, and I really do appreciate the opportunity to speak English. As at home here, we do speak Norwegian.
I get it.
Yeah.
And so, you've got an illustrious career, extensive training. And so where did the University of Iowa come in that sort of chronology? And why did you decide to come to Iowa City?
Well, I was at the University of Iowa from 2002 to 2008 doing the doctoral program. Why did I decide to come there? That's a good question. Why would a girl from Minneapolis and an alumni from the University of Minnesota come to the University of Iowa? Good question, Well, here's the answer. In 2002, I already had an established career in nursing in Norway, and I was looking for a university in the United States where I could do my doctorate. I'd done all my other academic work in nursing in Norway, and I wanted to spread my wings and reconnect with my roots in the US. And so what I did, I let my passions in nursing guide me. And one of my first passions in nursing is standardized language, standardized nursing language, and evidence-based practice. And of course, Iowa, the University of Iowa, is the center of nursing classification or standardized language in nursing in the United States. So this is a passion that I still follow through with when I'm on with the International Council of Nurses. I'll probably come back to that. So my second passion in nursing is nursing leadership. And at the time, the University of Iowa was ranked very highly in nursing administration among American universities. So there you have number 2. So, but what was the clincher? This is it. I came down for a visit in 2001 to consider doing my PhD at Iowa. And I saw the beautiful nursing building overlooking the Iowa River. And I was so impressed. it made me feel that nursing is valued at the University of Iowa and that nursing has a strong identity here or there. And this was the deciding factor for me. I decided right there and then. And of course, that reflects, strong academic nursing leadership through many years. That kind of identity doesn't develop overnight. So, and that was really the clincher for me. So, of course, it helped that Iowa is also located in the Midwest, not too
Right.
far from Minnesota.
Right. So not
But,
a big culture shock. Right. Right.
yeah. So there you are. That's why.
Well, in terms of the building, it's still there. And I don't know if you've come back to campus since you received your doctorate, but the College of Nursing, the building itself, has received multiple upgrades. And so it has this beautiful patio area. It's got revamped office space. It's got some really, really nice conference rooms, some excellent classroom facilities as well. And if I am not mistaken, our College of Nursing is ranked fourth in the United States right now, according to the most recent U.S. News rankings. And so we are, obviously very, very proud, fiercely proud of our Iowa College, University of Iowa College of Nursing, and it's only getting stronger and only increasing its reputation. So you made an excellent choice to come here, and no doubt others will follow your example, and they're already doing that. So kudos all around to our College of Nursing.
Yeah, for sure. It's wonderful. So,
and tell us a little bit about the subject of your dissertation, and why you chose it.
Well, I chose the topic of poor pain management and its relationship to delirium in older adults with hip fracture. When I was at Iowa, I worked with Dr. Keelaher and Dr. Marita Titler on a research project that they were doing on pain management, evidence-based pain management in older adults with hip fracture. Mm-hmm. And that was really an eye-opener for me. And of course, it's very much related to my background in intensive care nursing and also my interest in pressure ulcers and pediatric nursing. So not pediatric, orthopedic nursing, sorry. And it was through that experience that I chose that subject. And I actually did my dissertation research at Louisville University Hospital. So when I was at the University of Iowa for 3 years in living in Iowa City, and then I went back to Norway to do the actual dissertation research at my hospital. So it was a combined effort there, and I did. There was a project ongoing at Louisville University Hospital, working with older adults with hip fracture and improving the care that they receive. So this seemed like a very good topic for me to be involved with.
Very good, very good. And so obviously you're an accomplished practitioner, and that's how you began your career in nursing. But then you moved to a more policy-based focus, in terms of programming, administration. We know that's one of the reasons why you came to the University of Iowa in the first place. So what prompted that move from practice, the clinical experience to, formulating policy and then implementing that policy through administrative positions?
Yeah. It was really quite interesting that you asked, because I think I've always been very interested in policy or working for what's right, an advocate for fairness and fair treatment of individuals, etc. But I was a union representative for the nursing research department where I worked when I started on my dissertation research, and I was also a board member of the geriatric specialty group at the Norwegian Nurses Organization. So, and then in 2009, the Oslo University Hospital, where I worked as a researcher, was going through a major merger, and the Norwegian Nurses Organization at the hospital, the local level, asked me to represent them and the research and education working group. And the locals from the union were very satisfied with the work I did. And then one of them came and knocked on my door, and they said, would you be interested in being nominated to the national board of the NNO? And I said, well, yeah, that sounds interesting. So I got elected in 2007, and that was the beginning. Since then, I've been engaged in nursing politics and health policy, and I was elected vice president of the NNO in 2011 and served for 8 years. So I represented nurses at the national level, and due to my ability to speak English well, I represented the NNO at the European Federation of Nurses and the European Forum of Nurses and Midwives. They lobby with the WHO Euro and the International Council of Nurses. And now, even though I'm officially retired, I was elected vice president of the ICN and the European Forum, with the support of the Norwegian Nurses Organization, of course, because they're the members of those organizations.
Right.
So I guess that's it. That was a huge change.
Yeah, no, exactly.
Yeah.
I mean, it's like you had a whole other career, really.
Yeah, in many ways it was. But of course, when I was the chief nurse of Ullevål University Hospital, I was very much engaged with working with the union, of course, because they represent our employees, and of course it was necessary to have that dialogue. Social dialogue is very important in the Norwegian system, and so I got to jump from one side of the table to the other side of the table, and also in Norway it is possible for nurses in administrative positions to also be members of the union.
Okay.
Whereas in the United States, I think that at least my mother has said that was not.
Right. Well, I mean, often there are conflicts of interest, and it may depend on the particular union, but sure. I mean, that's always a consideration. And so, you mentioned the International Council of Nurses, and then also you've been part of the Global Nursing Leadership Institute for quite some time. Can you talk about what these organizations do generally, and then describe your role in them?
Yeah, sure. Well, the International Council of Nurses, you already mentioned it in your introduction, but it's the global voice of nursing, representing the world's 28 million nurses. And ICN advances the nursing profession. We promote the well-being of nurses and advocate for health in all policies, health for all. And like you said, there are 135 national nurses associations in membership with ICN. And we have an executive board with 11 members. And our current ICN president is Pam Cipriano, and she was formerly the president of the American Nurses Association. ICN is very important. It establishes the international norms that are important for nursing, such as the ICN Code of Ethics, which is the foundation of nursing practice. And we recently revised the code. We do that on a regular basis. And the most recent code also introduced global health as an important area of nursing practice, and with ethical implications. And another aspect is that we define nursing. The definition of nursing, the definition of nurse and nursing are developed by ICN and are regularly reviewed. And this is very important because as the norm, it's very often used by national governments when they're developing their laws, legal structures, etc. And also it's used by the World Health Organization and other international bodies. So that's very important. We also have a definition of advanced practice nursing that's used all over the world. And ICN also developed, for example, the International Classification of Nursing Practice as a nursing standardized language. So those are some of the very important, what should I say, agenda items that ICN is known for. ICN also represents nurses at the United Nations. Way back in 1948, ICN became one of the first NGOs to be recognized by the United Nations, and we're still working with them. And today, of course, there are many items on the agenda of the UN that are very important to nursing and to health. For example, non-communicable diseases is on the agenda of the General Assembly. The universal health coverage is one of the sustainable development goals, of course. And then we have the Commission on the Status of Women, which is, of course, very important to nursing as a highly female profession.
Right.
With over 90% of nurses are women.
Mm-hmm.
So those are just a few of the very important areas that we work with the UN on. But ICN is also a partner with the World Health Organization, also going back to 1948. We have each year a delegation to the World Health Assembly, which brings together the ministers of health from all countries around the world, 196 countries. And they spend a week in Geneva in May and develop policies and discuss the different aspects and develop action plans, etc. And so I've attended the World Health Assembly on numerous occasions and representing ICN. And I've held different statements, read different statements that have been developed by ICN. On different agenda items. And also the WHO Regional Committee, which in Europe is the 53 countries of the European region. It's Europe and Central Asia, actually. And just last week, the Regional Committee of WHO Euro met in Kazakhstan, and we developed statements on the health and care workforce. Of course, that was extremely important for us. Refugee and migrant health, for example, antimicrobial resistance, and emergency preparedness, which of course focused heavily on the war in Ukraine and the recent developments in the Middle East. Israel is a member of the European region of WHO. So these are just some examples. I can also mention that ICN was a partner with WHO in developing the first ever State of the World's Nursing Report. That came out in 2020. And subsequent to that, we developed the Global Strategic Directions for Nursing and Midwifery. And that was developed unanimously by the World Health Assembly. Now, that means that all ministers of health around the world have committed their governments to work on improving nursing and midwifery by implementing this global strategic plan. And we advocate for increased investment through this plan in nursing education, nursing leadership, decent jobs, and improved service delivery. And we also, and I don't know if you want me to just continue here.
Oh, it's fine. But I guess a couple of questions sort of come to mind. And so, I mean, obviously, ICN performs wonderful global service. I would have to ask, so what was your life like during the pandemic, especially from the standpoint of ICN? Because I think you're the second vice president. And I think your term lasts until 2025, and your term begin in 2021, so probably right at the height of COVID. So what was that experience like from an ICN standpoint?
Well, ICN was very early on began to advocate for the situation for nurses around the world, and of course, I was very much involved in the decisions and the work that ICN was doing at the time. our member associations around the world were reporting into ICN that they didn't have personal protective equipment. They were reporting into us that a high number of nurses were getting infected. And sadly, they were also reporting a number of deaths among nurses. And ICN, we brought this to the table of the general director of the World Health Organization, Dr. Tedros Ghebreyesus, and ICN started collecting data systematically, and we went public with that information through the media. And ICN was also very concerned about vaccine inequities.
Mm-hmm.
Many nurses and health workers around the world did not receive their vaccines. There was a lot of hoarding that went on, and especially the countries in Africa and Asia did not receive vaccines until very late in the pandemic, and many still have not received. So during and after the pandemic, we reproduced reports that document the impact of the pandemic on nurses' health and their mental health. And there was a global shortage of nursing before the pandemic, but this has become much worse after COVID. Many nurses are now leaving the profession. Many have suffered severe mental health issues, and many have suffered moral injury. And I think that comes from, taking care of critically ill and dying patients, and then walking out of their hospital and seeing anti-vaxxers and other demonstrators outside the hospital, and seeing that discrepancy between what they were doing and what they were being a part of, dying patients, and what others were refusing to accept that COVID was real. And many nurses felt moral injury due to this discrepancy.
No, and go ahead.
No, go ahead.
I was going to say, I mean, that's perfectly understandable because, in this country, we know that there is a shortage of nurses. And in fact, at the University of Iowa, we are, beefing up our nursing program to address this shortage. We're working with our Board of Regents, we're working with the state legislature, because this is a need, this is a void that we have to fill. And so apparently, this nursing shortage, the fact that nurses are leaving the profession, the fact that they are, dealing with numerous mental health issues, is apparently a worldwide phenomenon. We hear a lot about it in the U.S., but not so much about what's going on in the rest of the world. But apparently, what's happening here has, no doubt, or we've seen similar circumstances almost everywhere.
Yeah, and ICN has stipulated that the nursing shortage will reach about 13 million by 2030 if we don't ramp up investment in nursing education and in retention of nurses to stop the hemorrhage of nurses leaving the profession.
Right.
So this is an important area of advocacy for the International Council of Nurses, for sure. So we've issued warnings that the current nursing shortage represents a global health emergency. And ICN has called on governments and societies to value, to protect, to respect, and invest in our nurses for a sustainable future for nursing and healthcare. Healthcare cannot survive without the input of nurses.
Right. And I know that,
largest profession. Yeah.
Exactly. And I know that in our previous discussions, we've talked about the importance of, having a strong nursing infrastructure to have, to build a solid and strong society just in general, that, many people take nurses for granted and nursing for granted as a profession, that there's kind of a tendency to not see nurses as really human, or not to see their own kind of needs for support, for security, for just their own well-being, or ensuring that their own well-being. And so one of the reasons why we wanted to, have this webinar was because we wanted to showcase your important work in this field, because it's easy to, overlook the needs of healthcare professionals. It's easy to take people and systems for granted. And our job, in part, is to put a human face on what's going on here.
Yeah, thank you for that. Of course, and it takes a lot. It takes a lot of advocacy work, and the part of the challenge is that although nurses are the largest profession in healthcare, during the pandemic, we really didn't see a lot of nurses representing healthcare on the global scene. So nurses are very often not included when policy issues are discussed and decided. We're just very often overlooked and not at the policy table. So this is really one area of work that ICN also is very much concerned about. And that's where the Global Nursing Leadership Institute comes in. Because in 2009, ICN began the Leadership Institute to develop senior nurse leaders in countries around the world, to develop their ability to enable them to advocate on the global scene, to advocate within their country for greater investment in nursing. And so this has been a very important program. And I took the program myself in 2016. That's right before I came onto the board of ICN in 2017. And now I work as a program facilitator, especially in the European region. And during the pandemic, the entire program was delivered online. But this last week, 30 scholars, very highly educated nurse leaders, met in Geneva for part of the program. So ICN is really greatly concerned about the protection of nurses and health workers in conflict and war zones as well. And ICN established the Nurses for Peace campaign in 2020, following the Russian invasion of Ukraine. And we received a lot of financial contributions from around the world, and we're working to get those funds into the hands of nurses in Ukraine. And in February, ICN will hold a leadership development program for leaders in Ukraine, nurse leaders in Ukraine. And I'm going to go to Ukraine to help them implement the program. We're only going to be 20 kilometers on the inside of the Ukrainian border, and yet I'm really looking forward to that.
Right. It's still, Ukraine is Ukraine, and it's
Ukraine.
Certainly a risk. And we applaud your audacity and your boldness, to go into a war zone and advocate for nurses and for nursing, and to advocate for peace and global security. Right.
And Russ, I told you before I told my husband.
I
haven't really told him yet.
Well,
I'm really hoping I'll get there.
Yeah, I realize that those could be rather delicate conversations. So, well, we appreciate knowing that here on the Global Alumni Spotlight.
Told you a secret.
Definitely. Well, it's I think it's a situation where a lot of this comes back to security, and if nurses aren't protected, if healthcare workers aren't protected, and there are so many war zones, all over the world. Obviously, we think about Russia, Ukraine, we think about the Middle East, but there are numerous war zones in Africa. There are some in Southeast Asia as well. And my guess is that nurses are among the most vulnerable populations, because they're going into areas where people are afflicted, they're suffering, and they're not protected either. So that has to be, a very daunting, at the very least, prospect to go
Yeah.
in and provide healthcare in zones that are quite precarious.
I agree. And healthcare is supposed to be a neutral
Right.
arena. And we're seeing the opposite development. I mean, the international conventions don't seem to apply anymore. And
No.
we have the campaign, healthcare is not a target. And yet we see that very often healthcare is actually targeted purposely by perpetrators. Which is really tragic because that's where it should be a safe haven for those who are sick and afflicted.
Exactly. No, and I think it's very important that you point that out, because the rules of engagement have, completely dissolved. And there's a degree of violence and anarchy, and I would say even inhumanity,
Hmm.
that we haven't seen in quite some time.
Yeah.
And this destruction of order, and the idea of, and the danger that comes with it, especially for healthcare workers, means that the humanitarian mission can't be carried out. And so it's really important, I think, that we remember one another's humanity and the fact that we all need health care. We are all vulnerable at certain moments, but when political and military circumstances make us even more vulnerable, that only increases the importance of healthcare delivery and the protection of healthcare workers along with it.
Yeah, I couldn't agree more. And that's what most of my career in policy has been directed at, is really the protection and safeguarding of health workers, not just in war zone, but in everyday clinical life, that we have decent working conditions that do not encumber the workforce, which is one of the issues now with the huge nursing shortage around the world, that those nurses who are left in the and stay with the patients, stay in their positions, are really overloaded with work, and that of course is really not a good situation either. So there's a lot of work that needs to be done to develop good working conditions for nurses.
And so I know that you work a lot, say, with the World Health Organization. I'm wondering about sort of other medical organizations that go into sensitive parts of the world, or parts of the world that are experiencing violence, like Doctors Without Borders, even the Red Cross, the Red Crescent. Do you work with those agencies as well?
Yes, in fact, I moderated a session at our Congress in Montreal in July this year. And one of the persons who was there was the chief nurse of the Doctors Without Borders. And of course, she had a tremendous presentation of how nurses are one of the most important groups working for Doctors Without Borders. Really should be Doctors and Nurses Without Borders, because they're the largest group actually working for Doctors Without Borders. And they do a tremendous work. They're a non-state actor as we are, and of course their voice is really important to bring to the world stage as well.
Right. And
And
so
the Red Cross, of course, as well. So
exactly.
there are
And
many
so,
non-state actors, yeah.
right. And so if you don't mind me asking, who are your major funders? Is it the World Health Organization? Is it private donations? Is it, large foundations? How does the organization maintain itself financially?
Well, this is a challenge actually, because our main source of income is our members.
Mhm.
So developing our member associations is also a very important part of our work, because it also means that increases our income. The more members that our member associations are able to recruit and that they pay their membership dues to their organizations, that really trickles over down to ICN. So our major source of income is actually our national NNAs. We do have some support for projects from the World Health Organization. And we work for one of our projects, the Global Nursing Leadership Institute is also funded or has been funded by the Burdett Trust for Nursing, which is a British or a foundation in the UK. And we do have other supporters. BDO, for example, is supporting a project that we have with National Nurses Associations in Africa, and also the Johnson & Johnson Foundation is a supporter. They support us for particular projects that we do with them. But our general running expenses is supported by our members.
Very good, very good. And so, as we kind of switch gears here a little bit, in our previous conversations, we had talked a lot about climate change, and here, because in the nursing space, in the healthcare space, I mean, obviously you're dealing with all sorts of global challenges. So security, war, no doubt that climate change has also affected your strategic planning and practice. And so I'm wondering what or how your work has been affected by climate change and the work of ICN. And then what related opportunities and challenges do you see in the realm of global health policy because of the way the world's climate is shifting?
It's shifting, yeah. Well, climate change is the biggest health threat facing humanity today. Every day, nurses are witnessing and dealing with the profound effects of the climate crisis and what that impact is having on humans' health and well-being. Nurses are caring for people with bronchitis, for example, asthma that's worsening due to air pollution and wildfires. Nurses are seeing an increase in deaths in children under 5 due to diarrhea because they don't have safe water sources. Older people and homeless are vulnerable to heat exhaustion and heat stroke. And of course, when they are, that's due to climate change. And of course, nurses are involved when their integrity as individuals is challenged. So the occurrence of more and more extreme weather conditions with emergency situations that result, that also has a tremendous impact on the nursing profession. For example, consider the flooding that we've seen in the past summer. We had torrential rainstorms in Norway resulting from flooding, flash flooding. This was a situation that also many other areas of the world experienced. In Norway, we have we can call out the National Guard. We can call out, the civil society is very much engaged when we have a national emergency like that. But in other parts of the world, where people are displaced and where they're suffering from loss of family, loss of home, loss of work, so much loss, there really isn't a lot of structure to care for them. And in these situations, very often nurses are mobilized as part of the health team. And it's part of ICN's mantra, our raison d'etre in a way, to strengthen nurses associations to develop nursing as a part of civil society. And as strong as we can help them to become, the more they are able to contribute to the challenges that their populations are facing, including the challenge of global warming and climate change and the impact that's having. So ICN also works on the global stage to represent health has become very much a part of the discussion about global warming and climate change. And ICN attended, for example, the COP26 in Glasgow in 2021. We were represented at the COP27 in Sharm el Sheikh in 22. So here, the ICN has, as a civil society organization, comes to the fore, our role there, to advocate for health. ICN joined together with 45 million health professionals worldwide to sign a letter to the governments of the world, those that were at the conference. I think there were 197 governments at those conferences, and to tell them what impact global warming and the climate crisis is having on the populations of the world, and to encourage them or demand that they act now to
Right. And
try to reverse the challenges that we're seeing to health. We can't have a healthy population on a sick planet.
Indeed. No, very well said. Because it's the most vulnerable populations, as you mentioned, that are already facing disparities in health access, that see these disparities only worsened by the climate crisis. And so the work that you're doing, especially probably in the Southern Hemisphere, or kind of in the global South in general, bears witness to the aggravation or the worsening of this situation writ large. So populations that are already sick and vulnerable are even more so, because of the fact that we keep experiencing the hottest month on record. This past September was the hottest September the world has ever experienced. The same for August, same for July. The numbers for October aren't in yet, but my guess is that October is going to be the hottest that in human recorded history.
Even if we're having a blizzard today and tomorrow.
Right. And even if we had snow flurries in Iowa yesterday, it doesn't matter, because the earth is getting hotter.
Yeah.
Right. Yeah. No, so I think it's really important to stress the health hazards and just the dangers that global warming poses on so many levels, and it obviously destabilizes world security. You've got populations that are moving. You've got populations that are starving or don't have enough adequate drinking water because of global warming. And so, as nurses, you have to deal with that in a very immediate way.
Yes.
Very good. So we do have some questions from the audience, and I'll read those in a second. But I did want to just ask one final question, or final couple of questions, and that is just to get back to the University of Iowa. I'm just wondering if you could summarize how the University of Iowa itself shaped your career trajectory, and then what advice would you give to nursing students or early career faculty who want to pursue international interests?
Well, I think my career trajectory, just doing a doctorate, I think was significant in itself. I was the first nurse with a doctoral degree to be elected into the Norwegian Nurses Organization's executive leadership team. And I think that gave me added advantage when I stood for election, that I had the doctorate. And of course, it was in my curriculum vitae that I attended the University of Iowa. And working on my doctorate at Iowa lifted me really to a new level of awareness. And that strengthened my nursing identity, really. So doctoral preparation really gives you authority. And that's often an advantage, especially when you're working internationally. So I was very grateful for the time that I had at the University of Iowa. I was able to spread my wings and really, take a step back and and look back on my career, but also look forward to my future career when I was there. To nursing students and early career nurses and faculty, I would just say to get involved. No matter what your passion is in nursing or in other areas of society, you'll find fellow nurse colleagues at the national and international level who share your passion. And the UN, for example, is actively soliciting engagement of young people and students. And just last week, one of our scholars at the Global Nursing Leadership Institute is actually doing her doctoral research looking at nurses at the UN. So that's the focus of her research. And she's working with the ICN liaison at the UN on her doctorate. Very exciting. So just get involved. It's really exciting to meet people from other countries, other cultures, and you can do that by becoming involved. And do it when you're a student. Don't wait until you get to the doctoral level. Start when you're a student. And this has really been one of my heartfelt issues, really, within the ICN. We didn't get a chance to talk about it, but bringing students into ICN and working collectively with them has been really one of my goals with ICN. So,
right, and so I get
involved.
Right, and so I guess that leads to sort of a follow-up question. Can nursing students do internships with ICN? Are there opportunities to kind of shadow you and other administrators to kind of see what the organization does?
Well, actually, our president, Pam Cipriano, does have a student who's shadowing her, and she's participated at a couple of our board meetings. So definitely it is possible. And it's also possible to attend the Global Nursing Leadership Institute. And then you would get to know both ICN, but also the World Health Organization and how ICN works at the UN and with WHO. Very exciting.
Yeah, so it seems like those are opportunities that nursing students and others should consider. I mean, I'm not from the nursing world, but I know many of our colleagues in the College of Nursing, and they all seem like wonderful people. They're all kind of, they're warm, they're inviting, they're easy to talk to, they're accessible. So it seems to me that the nursing profession is, very, very open and very supportive, despite, or perhaps because of all of the hardships and all of the challenges that you face, that there's a real sense of community and support among nursing professionals. And so anyone considering that realm would know, at least, or be assured that they'd find a strong community around them.
I agree wholeheartedly.
So let me, as we kind of wrap things up, let me just pose a couple of questions from the audience. So one is the audience member says, I'm interested in the impact that international aid can have on the world's most vulnerable populations. And so, we've spent a lot of this conversation talking about issues, problems, challenges, but maybe you could share some of the success stories where there's really been, a positive impact from the ICN's either influence, its policies, its programming. Maybe share those those happy moments, as it were, with us.
Mm-hmm. Well, one of my happiest experiences has been the Norwegian Nurses Organization has worked with the nurses organizations in sub-Saharan Africa, and I think especially perhaps Rwanda and the amazing transition that they've made. And this was with the support of Norwegian Aid, which is the counterpart of US Aid, you might say. And through the program that we've had and the direct assistance, both financial, but more supporting them in developing their organization, they've transitioned to become a union. And when they started out 10 years ago, they only had 500 members. But today they have 12,000 members. That's over 90% of the nurses in Rwanda are now members of their national association. And they're learning so much about how to advocate for themselves with their government to negotiate better wages, better working conditions, etc. And that means a lot because those nurses are really critical to help the population of Rwanda with their health issues. So by strengthening the Nurses Association, strengthening the nurses, we're also strengthening their and enabling them to support health for all in their country. So for me, that really is a success story that I like to tell about. But also working on the Sustainable Development Goals, we were making a lot of progress prior to the pandemic. But of course, the pandemic has really given us a major backfall. And so we're trying really hard now to catch up. So the World Health Organization is working together with ICN, with the World Medical Association, with professionals, with civil society to strengthen, and with governments around the world, of course, to step up our action when it comes to non-communicable diseases, when it comes to working with reducing maternal mortality, child mortality, all of these challenges that we face. And that's where we are now. We're trying to catch up after the pandemic and working together towards that goal. And I think the pressure that we can put on the national governments to prioritize health, because this is where we are. National governments need to prioritize health in order for us to be able to move forward and support our populations.
Right. I mean, because my guess is that, on a political level, there's a lot of lip service given to health and healthcare delivery. And it is, a major part of the world economy. At the same time, it probably doesn't get the support that it needs in order to be at its most effective. So I think the point is very, very well taken. Final one comment and then a final question. So one listener thanks you for your leadership. It's always good to get that validation, for what you do. And then the final question is, what differences can you note between nursing in the U.S. and Norway? I know that's kind of a vast question, but maybe if you could summarize it in just 2-3 sentences, that might be helpful.
Well, I think that there are more similarities than there are differences. So I don't know if that helps as an answer, but I think there are a lot of regulations and stipulations, perhaps more so in the American health system. There's a lot of red tape, a lot more red tape. We have a national health service in Norway, which means that we don't have to document every pack of gauze or every bandage that we take out of the cupboard and document that has to be charged to the patient. For example, that's one major way that we perhaps see the difference between our two healthcare systems, of course.
Right.
So Yeah.
And
we have an extensive primary health care in Norway, and that's really a growing sector, even though it's always been very strong. We have home health care is a very major part of healthcare in Norway. And I think that's a major difference, perhaps, that we try to keep people in their homes as long as we possibly can, and deliver home health care. Nursing is free of charge in Norway. And I think maybe that's a big difference. It's the health systems that we work within rather than the actual nursing care that we provide, I think.
Right. So yeah, it comes down to kind of the infrastructure, the administrative regulations, and just probably the funding model as well. No doubt has marks a big difference between the two systems. Well, listen, Karen, this has been absolutely fascinating. It's been wonderful to get to know you. Thank you for your service to the global community. And thank you also to the ICN for all of the great work that it does. Again, we want to raise awareness, bring notice to really kind of the unsung heroes. And during the pandemic, it was a priority to applaud and celebrate healthcare workers. My hope is that we can continue to do that, especially on a global scale. And nurses themselves couldn't be more deserving of that. So thank you.
Thank you for having me. I really appreciate the opportunity to come to the webinar today. Thank you so much.
Very good. And so please let me thank the members of our audience for tuning in. And just a reminder that the video of the webinar will be available on International Programs YouTube within the coming days. We'll be sure to send a notice to that effect. So thank you again, and have a good afternoon or a good evening, wherever you may be. All right.
Bye.
All right. Bye-bye.